The COVID vaccine is expected to be in Brunswick County by Thursday.
Novant Health anticipates receiving our first allocation of COVID-19 vaccine, the Pfizer product, this Thursday.
Now, that was Dr. David Priest. He is the Senior Vice President and Chief Safety, Quality, and Epidemiology Officer for the Novant Health System. He briefed the media today on what to expect.
We have approval to distribute vaccine at 3 of our facilities in the state of North Carolina, those being Novant Health Forsyth Medical Center in Winston-Salem, Novant Health Presbyterian Medical Center in Charlotte, and Novant Health Brunswick Medical Center on the North Carolina coast. Our week 1 allocation for the system is 6,800 doses. We have purchased ultra-low freezers that are needed for the vaccine, particularly the Pfizer product. And we have storage capacity for more than 500,000 doses in those freezers and more than 1 million doses at frozen temperature. So we're very excited about the infrastructure in place to handle that vaccine.
So who will be eligible and when?
Right now, as you may be aware, we're in phase 1A of vaccine distribution, which includes high-risk healthcare workers and first responders, long-term health facility workers and residents, as well as adults with more than 2 chronic medical conditions. And we're working to immunize all of our team members who are patient-facing, as well as any of them who could come in contact with COVID-19, particularly given the high rate of virus activity in our communities. We are giving priority to team members at the highest risk, including team members working in emergency departments, intensive care units, our COVID-19 units, those screening assessment centers in our communities where we do a lot of testing of individuals in the community, and anybody we think will be essential to our vaccine response. Patient vaccinations will begin in phase 1B and will include adults with 2 or more chronic conditions that really put them at risk of severe illness as defined by the CDC. And then, as I think you're aware, phase 2 and phase 3 will increase the number of our clinic-based sites for vaccine. We'll have mobile immunization sites. We continue to partner with our GoHealth urgent care centers, local pharmacies, and the local health departments to create really additional access points for all members of our communities. It's very important that we have fair and equitable distribution of vaccine for everyone. And then phase 4 will be widespread immunization, and our plans will continue to evolve as the vaccine supply increases, and we anticipate that's going to happen as we get further into the first quarter in 2021.
Now, Dr. Priest also addressed those who oppose vaccines.
We know there are concerns or anxieties people may have about receiving a new vaccine. There's certainly a lot of misinformation in the community, particularly on social media around vaccines. There are a lot of conspiracy theories out there. We know that the anti-vaccine movement overall is very well organized and gets a lot of things into the space on social media. Much of it is not true. So we encourage individuals who want good information about COVID vaccine to look at the CDC website, cdc.gov. Look at that website, go to reputable sources. Don't rely on social media or things that have been passed around social media to get your information about this particular vaccine.
And Dr. Priest says the testing of the vaccine has been comprehensive, but he says there could be side effects.
So we do know in clinical trials that some participants experience some common what we're calling expected effects and not side effects. When you get a vaccine and your immune system responds, we expect certain things to occur, including having a sore arm, maybe some malaise and fatigue, occasionally a low-grade fever. Those things happened and lasted only 1 or 2 days in some people, and there were no serious safety events beyond that. So we think people are going to have expected effects from this vaccine like they do to other vaccines, and it really just shows your immune system's reacting and doing what we want it to do.
And he acknowledged that getting the vaccine for Novant Health staff is not mandatory now.
We're talking through those issues. We have a call with our team members very frequently. We get asked this question a lot. We're trying to educate everybody on how the vaccine works, the amount we have. And I think when they see what's happening in our hospitals and the toll it's taking in our communities, we think we'll have really good uptake of vaccine in our organization. We currently, like most healthcare systems, do require influenza immunization for our team members. And so anytime there's a vaccine that could be life-saving and protecting our patients, we will certainly consider the idea of requiring it at some point, but we're not at that stage yet. And I think we're in line with all other healthcare systems within the state of North Carolina.
And finally, Dr. Priest offered a holiday warning.
It's really crucial we don't let our guard down over the holidays, and we understand the desire to gather with your family and friends. This is going to be a holiday season like no other. And we've really got to try to maintain social distancing and masking, really to keep ourselves safe, or we're going to have a tragedy on our hands. And I think it'd be a real big tragedy to have people get COVID, be hospitalized from COVID, and heaven forbid, die from it a few weeks before they're able to get a vaccine. So again, we're very excited about how the vaccine is going to roll out and where we're going with that.
Now, for more information on the vaccine and other health issues in Brunswick County, go to the Novant website. We will try to bring you more COVID vaccine information as it becomes available here at News. I'm John Daly for News.